The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all the listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far, and looking forward for a nice and relaxing weekend. It's good weather though. This program is broadcasting live from the studios of Inspire FM today, Thursday, 4th of July 2019. And casting its positive vibes to all our lovely people in Luton. Positive vibes going all across Luton and all the surrounding areas of Luton, like Dunstable, Harpeth and Bedford, and definitely reaching airwaves through our website and app and through via Facebook. You can view us on our Facebook page by going to Inspire FM Facebook page and click live view. If you're listening this show on Sunday or any other Thursday, that means it's repeat. But hey ho, today is not a repeat show. Today is 4th of July, so it is a live show if you're listening 4th of July. Right, so as we all know that every single week we bring a different health-related topic, and we try to put some shining lights on the topics which are on the topics which is being needed by the community in different aspects, and we try to spread knowledge as much as we can at the time needed. So, but then every single time we try to cover different aspects of life and different topics accordingly. So today's topic is again in the same vision. We are trying to view the issues of this one through different vantage point. But before that, let me share a very unique statistics which is directly related to my show. So do you know that 56% of children says they worry all the time about something, which is really surprising, and it is quite a lot of percentage of children who are worried about something or everything, and that is something which we will be shining a light on. So without further ado, the topic for today is mental health in young adults and children. Yes, you have heard me correctly. We will be talking about mental health in young adults and children. And definitely, as you all know, I'm the presenter of the show, but not the person who will be keep talking about this topic. I have such a lovely guest today with me in the studio. So joining me today is a doctor who's specialized in child psychiatry. Is Dr Sadaf Mufti. Assalamu alaikum, doctor.
Wa alaikum salam.
How are you today?
I'm fine, thank you.
And also joining me today from CHUMS is Declan Deggan. Hi, Declan.
Declan Deggan, yeah.
I'm so sorry.
It's a tongue twister.
Yes, exactly. And it is. Sorry, how do you pronounce?
Declan Deggan.
Declan Deggan
From CHUMS.
From CHUMS. And shortly joining us very soon will be Javeria Hussain, who's our local councillor for South Luton Ward. So thank you so much, guys, for coming in today. So let's ask you guys to give a bit of intro about yourself. So let's start with you, Doc.
I am a specialist in child and adolescent mental health. So I'm a consultant level. I currently work in Hertfordshire, but I was working in Bedfordshire until like April last year. So I know a little bit about how the services work here as well. And I just met Declan a little while before the show, and I was just telling him how wonderful his organisation is and how impressed I am with CHUMS. I think we need to know a bit more about what CHUMS. That'll be Declan.
Yes. So I think that's our cue for moving to Declan.
Yes. Well, thank you for inviting me to the show. It's a real pleasure to be here. As you nearly rolled off your tongue, my name is Declan, and I work for CHUMS charity. CHUMS has been going for 21 years now, and I have a very close and emotional personal tie to CHUMS because when they first began 21 years ago, they looked after my family. They were started off as a bereavement charity, and they looked after my daughter, who was 10 at the time, after my son was tragically killed in a car crash. So I have an affinity with CHUMS that goes back a long way. I've been involved with them on and off over that period, and over the last year I've joined them on an official capacity. I am now the corporate and community engagement manager for Bedfordshire in Luton, and what I do is I try and highlight what they do, and I signpost people for what their services are, and I try and direct people to the right people who can help. And emotional well-being or mental health issues is very high on the agenda, and we try and work with as many local children in Luton as we possibly can, and I know that we've helped lots of children and young adults over many years in Bedfordshire.
And yes, you are very correct, because that is an issue which is very common but not very much highlighted as such in many different for many different reasons. And when we talk about kids, we talk about kids that they are happy and they are well maintained and so forth, yada. But unfortunately, that's not the 100% reality. The reality is slightly far-fetched from it. But then again, that's part of life. There's always goods and bads all across us. But let's involve our listeners as well, because Javeria will be joining us shortly. So in that time, let's involve our listeners. So listeners, if you have any questions or queries today regarding our show tonight, which is mental health in young adults and children, please give us a call on 01582 01582 I repeat, 01582 481822. I do not know why my tongue is still rolling. And if you like, you can send us your questions via WhatsApp and text messages as well on 07779 481822. I repeat, 07779 481822. And definitely that is a very hot topic in many different ways, and many near to heart topic for many people as well. And definitely we do like to know what your views are in this relation. And I'm a bit kind of lucky that my third guest has arrived. Let's ask her to introduce herself. Her name is Javeria. Assalamualaikum, Javeria.
Assalamualaikum. Sorry for being a bit late.
No problem.
Public transport. So for those of you who don't know who I am, obviously it's always a pleasure. It's my first time actually to be on Inspire FM, a brilliant community radio station in Luton. I'm a councillor in South Ward in Luton, born and bred in Dalla Ward, and I'm also a community activist and also a social justice campaigner. And things I've campaigned on include things such as mental health issues, inequality and social justice, especially in Luton.
Oh, wow. Okay. And definitely no problem. That's life. People do get late, and politicians, you don't expect them to be on time, definitely. But that's another topic. That's not the topic for that. Exactly. So, let's move on. Let's start from how do we recognize the range of mental health conditions in children and young people, because it's a very big range and it starts from one end to another spectrum. So let's start with our doctor. Doc, what do you think?
I think that there can be so many different symptoms, and I would want to use a different language. Let's use emotional well-being rather than mental health, because we necessarily, families necessarily won't think that their child is suffering from has a psychiatric disorder, and they're right. Quite often it's not like it doesn't cross that threshold where they would get a diagnosis of a psychiatric disorder, but they are suffering and they are struggling. They have a lot of difficulties and they need to be recognised. So the question is how we might pick. What are the symptoms? The symptoms would be that they might be more withdrawn. They might not. They might appear low in mood. They might just stay in their own room and not talk to anybody. So this is what the family can observe. Their sleep might be affected. They might not be able to express, because quite often children are not able to express, especially, depending on the family. It does vary from family to family, depending on how, what the relationship is like and how good they are in talking about things. And there can be other indicators. For example, they might not be performing that well at school. Their grades might suddenly start dropping. They might not want to go to school. So there are a lot of other changes that you can observe in them. But quite often they will also be trying to hide their symptoms. And one of the major things, like you were saying, there are 54% people, children. 56% children have reported that they worry excessively. So anxiety. So basically, that's anxiety, and they are worrying, and they've got lots of different reasons to worry. And so that if you find that your child is worrying too much and kind of panicking, so those are symptoms as well that you can pick on.
Declan, you have worked, being a parent yourself and gone through a traumatical incident, yes. And then you have worked with children and working with CHUMS. You come across these cases. What's your take on that?
Well, stress and anxiety are very, very prevalent now in young children. And there's so many different things for them to worry about. And whether it's schools, whether it's fashion, whether it's their house, whether it's their home, whether it's their families, whether it's jealousy, there's a whole range of why children are anxious. But anxiety actually runs in families, and it comes from the top down. And it's how we address it and how we deal with it as families, because they are the first port of call, is your family or your carers or your guardians. And it's how we deal with it. And children have to be able to have the space to talk about how they're feelings, and that's the emotional side of it. And you will find that once children and young adults are given the platform to talk to a responsible adult or a family member or their parents. Some people don't feel like comfortable talking to their parents, but they can talk to teachers or TAs or people who are in their community. And I think that's the first really place where they can get on the road to start thinking about what is it. Because half the time they're worrying not about too much. But the thing is, if it isn't picked up early, it grows and grows and grows, and then they become a real anxious state. So it's talking. That is the first step for all of these problems, is being able to find the right person to talk to.
All right, okay. How have you seen the community from the community perspective view, Javeria?
Well, for someone who actually lives, eats and breathes community, I know for a fact that when I was growing up, there weren't that many pressures apart from study pressures, but now children seem to be in an age of technology where social media is the prevailing force, and that has a huge impact on children, obviously wanting to be seen as being in their peers and so on, and not wanting to be excluded. So that puts a huge amount of pressure on children. We'll talk about schools. A lot of schools, but now, obviously, given the current education system, we have a lot of young children that need to, think about exams at a very early age. So they're finding it a bit more tough to grow as children and being normal children because of pressures such as exams. They need to start thinking early about what they're going to do in their lives, at the age of 7 and 8, which doesn't help. And from a community point of view, it's basically the lack of funding that we're now finding. When I was a child, I was growing up as part of the youth projects that were very important and a core part of community in Luton, where particularly young people and young children from BAME communities were able to take part in activities that were organised by local youth organisations, where they could actually mingle with other youngsters, go out in school outings. I mean, sometimes your parents or your family weren't able to afford those things. But however, having said that, through the ambit of community youth organisations, you were able to go out, you were able to mingle and develop core skills, but however at the same time have fun and take part in sports activities and days out. And obviously, given now we're in such a climate that is, I want to say this as a politician, austerity driven, which has had a huge impact on our youth services. That's obviously had an impact on our young children, and then they're not being able to have that kind of support and have those kind of activities which are very important for them.
In terms of when we talk about the mental health itself, and especially when we talk about child's mental health, one thing which commonly highlights and it triggers, or it kind of a highlighting factor, is the child's behavior. Now, in terms of that, and if you see this thing, so how does mental health affect children's behavior in this perspective, Doc?
I was, when I was thinking, what will I talk about in this program? One of the thoughts was I really want to talk about neurodevelopmental disorders, because they don't get talked about enough. We'll be talking about depression, we'll talk about other things, addictions and those kind of things, but we don't talk about autism spectrum disorder. We don't talk about ADHD, and they are there, and it's very prevalent. And only yesterday I attended a presentation on autism, and it's such a huge spectrum, and there are so many people who are functioning all right. I mean, autism doesn't straight away it shouldn't be translated now. It does get translated as somebody who's got a learning disability and who's got a lot of behavioral problems, challenging behavior. No, it's not. It can be somebody who is high functioning, high achieving, doing it all right at school, but then having serious meltdowns at home and tantrums and other difficulties, and they are dealing with it. And that needs to people need to be aware of it. That is your child having some social communication difficulties? For example, they're called. I like the term socially blind. They are, and so if your child is getting bullied from a small, from a young age, and keeps getting bullied in primary school and moves on to secondary school and gets bullied, it's because other children they can pick up something that parents might not have picked. There is something in the child, and that something is autism, and it's not an illness as such. It's just that they're different, and it is a developmental disability. And as I said, they might be functioning all right, but they're struggling, and they need to be identified, and they need to be told this is what you have, and then they can cope better with life, and others can understand them better. So that's one. And the other is ADHD. A lot of children who are kind of classified as naughty and things, but they're not naughty. They have ADHD, and that needs to be kind of identified as well. So there needs to be an awareness of these disorders, and then we can, like you were saying, what are other behavioral problems? So again, there's a lot of it. I think Javeria can talk more about it. I mean, what's happening in the community. I mean, what's happening with younger boys, in terms of why are they joining gangs, and what's happening to the country. It's a big problem. It is becoming worse by the day. Then there are other children, who will be looked after children, they'll be in care, and then having gone through that experience of having been removed from their family and then being placed in care, and then all the breakdowns of foster homes, and then that's how it it kind of goes out of hand, and their behavior goes out of hand, and they turn towards criminality. I mean, there's a reason why young boys turn towards criminality. Sometimes it's because they don't have a father figure in their life. They just need some kind of empowerment, and they get that from kind of joining gangs and having that belonging and having, and these are there. And then there are in our community, we need to talk about it. There is a problem of balancing the identity. So there's a cultural identity, there's a religious identity, and then there's other things. There is a clash, and we need to accept it, and we need to talk about it. And this can all be, talked about, and it can be sorted out. It's not something that can never be, we can never reconcile with different identities. We can have all these identities. For example, I know of a young girl, doing very well. Her father's a doctor, and then she is having a problem at the moment. She's questioning, some of the things her parents tell her, because she knows the religion as well. She says that, hey, it's not in our religion either, and it's not in the local culture either. Where is that? And this is something the parents have brought from their culture, but they are passing it on to her as religion. If I'm making sense.
Yes,
so
you are.
This is from a culture. This is a cultural thing. This is not a religious thing. But then here is this young person.
She get confused in the whole.
She wants somebody to talk to about it. So what we need in the community is we need some people who will listen to these people and who can address these issues. And there are these issues, and this all of this needs to be addressed.
And CHUMS perfectly fits on those ticks on the boxes.
CHUMS picks up the overload of what's happening in our society at the moment, and the reason why CHUMS is thriving is because it's the workload, unfortunately, is there. There are so many children being referred to CHUMS, and you're talking about growing up in communities, and as parents, we are the biggest role models growing up, and they are the first port of call. And then if it isn't us, it's the other members of their family or the extended family, or further out into the community. And it's, I touched on it earlier of children being able to speak to people, but I think the doctor just touched on it a moment ago about all the poor children who haven't got that stability, who are in foster care homes or in care, and it's very, very difficult. And I know that the workload, the capacity that the CHUMS staff are working to at the moment, there is it's running at full, and unfortunately, and I think Javeria touched on it earlier, and this is not a political show whatsoever. This is a medical show, but it all works because the cuts in funding are so well highlighted now that we haven't got enough staff to carry out the capacity of the workload. We could do with another 50 staff, but why have we got that? And CHUMS is a charity relying on fundraising in the community. And I don't personally, although I love CHUMS with a passion, and I highlight the work that they do everywhere I go. We need that. This type of work needs sustainable funding to carry out the service, not relying on shaking collection tins at supermarkets. We should be able to be funded in a proper and sustainable way to help these poor children who really need help. And if you look at the waiting lists for children to be seen, and if you go through the CAM systems, it can be 18 months, 2 years, and it's too late to work with these children sometimes. It's past and gone. We try and see these children as quickly as possible and then work out how we can help them. But the capacity now is everything is done sort of not thinly or sparingly, but it's difficult to catch all the children. And we had in families, I think 7,000 referrals last year.
Wow!
And we could only work with 4,500.
And those 7,000 referrals are from the whole Bedfordshire, or is it just from
Bedfordshire?
Luton?
Yes, from in Bedfordshire.
Okay.
And we could only pick up 4,500. So the other ones are still waiting to be seen or on waiting lists, and it's very, very difficult. We love the work though, and we will always do it, and we are there to do it. But funding is a major issue.
So, being a politician and a councillor, what are your visions to help in funds of to create funds and to support projects for mental health, Javeria?
Well, Luton Borough Council obviously works in strategic partnership with a number of organisations, including, the NHS Hospital, through which they work in partnership to ensure that their next 5 to 6 years, the main targets are ensuring health and well-being of communities, and that includes primarily children, because the children are the ones that are going to be leading us, especially this town, which is going through a huge transformation into the future, and that's important to start at an early age, and that's basically, as Declan has said, tackling those core issues. But I mean, there's one thing I actually want to touch upon. Obviously, we're not trying to be. This is obviously isn't a political show, but it's more on the health aspect. Is that it may be the case that there may be signs. I mean, children spend a lot of time at home, but the other time they do spend a lot of time is at school. Now, it may be the case that teachers, given that the workloads that the teachers have in terms of marking, administrative, and so on, they may need additional training to obviously identify, for example, what the doctor said, what autism, what are the signs of autism. There may be additional factors involved, things such as, a child who's really hyperactive, how to deal with that. Or it could be the case that, a teacher may feel that that's actually quite normal in a child, where a child is unusually aggressive. Again, a teacher can say that perhaps that this is probably them being, this is probably them, it's part of their growing up phase. So this is where I think the fact that, we need to support our teachers especially and provide them with the training that is necessary, with regular training and workshops for this.
I have to stop you over there, unfortunately, Javeria, because the time has passed really, really quickly. We're going towards a first ad break. We will be back after a few minutes, so stay tuned and we'll be right back.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening, and we are talking about a very important topic, which is mental health in young adults and children. With our lovely guests today in the studio are Dr Sadaf Mufti, Declan Deggan, and Javeria Hussain. And I think so I've mispronounced the name again. Sorry, Declan, how do you pronounce your name?
Declan Deggan.
Declan Deggan. Sorry, it's
a tongue twister in its own right.
Exactly. And unfortunately, I'm well known for mispronouncing my guest name. So apologies.
It happens to me all the time, so listen, please don't worry about it.
So how are you guys?
All good.
Very good, thank you.
Okay, so this program is broadcasting live today on 4th of July 2019 from the studios of Inspire FM for our lovely people in Luton and the surrounding areas of Luton, like Dunstable, Harpenden and Bedford, and definitely reaching all over the world through our website, web app, and mobile app, and definitely other social media outlets. Now, before we went on break, we were talking about the communal issues, and Javeria was highlighting it so nicely, and I interrupted her. I'm so sorry, Javeria.
You did.
So, but what can I do? It was time for break, and it's not easy to.
I know.
And sometimes we have to be very, very careful with politicians. We have to be very, very political with politicians. So, anyhow, so moving on.
No, I'm a member of the community first. I think the politics comes secondary. I love my community, but I'm a member of the community first.
I'm just kidding. I'm just kidding, Javeria. Yes, in terms of the community issues, and there are so many community issues, and on that note, I definitely want our listeners to get involved as well. So, listeners, if you have any questions or queries regarding our topic today, you can call us on 01582 481822. I repeat, 01582 481822. You can send your questions via WhatsApp and text messages on 0779 481822. 0779 481822. So now, in terms of the community, when we talk about community, there are the community issues itself comes very, very in a variety of range and areas. So let's, Doc, what do you think? What are the common communal issues you come across being a doctor in that field?
Yes. There's some issues which are very specific to Asian community. The first that comes to mind is stigma. So this obviously at the beginning I said, please change the language. Let's not use mental health. This is emotional well-being. And especially, I was trying to tell you that, among children, and we're young adults, I would say less than 18, it's not usually, it's very rare to actually see somebody with psychosis. So like in the last 2 years, I must have seen four patients with psychosis or bipolar, or, there is a lot of people who get the diagnosis, or who are given the diagnosis of depressive disorder, but it's iffy. If their life would change, they perhaps would come out of the depression. And it's not like that, the depression that you see with adults. So it is a lot to do. This is basically psychological issues, and often people want to deny, no, I don't have any issues. If you don't have any issues, you're not alive. If you have a head, you have a psychology, and if you have a psychology, you will have psychological problems. Yeah, that's how simple it is. And everybody has psychological problems, and if you don't have them, you're not alive. So we really need to get rid of the stigma, and we need to have a more understanding of psychology, which is lacking in our community. We don't have the language. In our language, we don't really have the relevant words about, like emotions. Have we taught our children the words for various emotions? Have we given them that emotional language? So your child comes to you, I've got a headache. He's not got a headache, he's stressed about something. So you have to make him say, no, I haven't got a headache, I am upset about this and that. And you have to kind of keep understanding your child, and keep guiding him in the right direction, and help him develop this language, because it's a lot, like Declan was saying earlier, it's a lot about talking. It is all about talking. First understanding what's happening. And when you're talking, so basically when you're able to talk about it, what it means is that you know about it first. And you can take a step back, and you can say, okay, this is what's happening with me, and then you can talk about it. Hey, I think I'm upset because the teacher favored the other student and didn't favor me, or my mother favors my other sibling and not me. So there are this thing that needs to be addressed. We need to have psychological, emotional language. We need to talk about psychological issues. We need to kind of identify it. Sometimes it's so frustrating. With Asian community, throughout the years, I've been working with Asian community. I wouldn't say a lot, but, I've had some patients. And it's very well known about Asians that, either they will be talking about physical problems, or it will be a spiritual problem. And what is the psychological problem in between, yeah? So they'll be coming with, a headache. And it's not a headache. It's something, I've got a tummy ache. It's not a tummy ache. The child is anxious about it. He's worried about going to school, so he pretends it's a tummy ache. And these kind of expression of psychological distress is more common among children anyway. And if, in our community, if we're not using those languages, if you're not talking about these things, because, as adults, we don't have anything at all, most people think, I've got nothing, I've got no problems, but it was
perfect, my childhood.
It is impossible. I would say it's impossible. Everybody has, there are minor and major problems, but everybody has problems, and you need to say that, and you need to, we need to be able to say that, and we need to identify them, and we need to talk about them, and we need to equip our children with the correct, language, so that they can express themselves, or it's going to manifest in different ways, and those are not going to be healthy ways. Yeah, and then spiritual. So I just touched on. So if it's not this, then there's this. But hey, there is if we have like a abdominal problem, a big, we'll go to a doctor and we'll see a surgeon. Yeah. Why is it when we got a psychological problem, we'll still kind of not want to see somebody who's an expert in it? There are experts.
Spiritual doctor, that is.
Yeah. This is also a science. It's not a fake science. It's a science. It's very real. It does fix a lot of problems, but our community needs to be more kind of aware of it and more accepting of this fact, because we don't seem to have accepted it. We kind of dismiss it because some people even think that if you are depressed, your faith is weak. No, it's not. It doesn't mean that. No, you have strong faith, and you can also be depressed. That's fine, because we're human beings and we'll go through all same sort of emotions. But faith, in a way, it does help. Of course, it's very, very helpful. And there's a lot of evidence out there that people who have faith, for example, youngsters who believe in God, they can cope better than people who might not have faith. And one of the things I wanted to say was, it's all right to, then the spiritual, unfortunately, some people start thinking, we need to go to faith healers and there's a jinn or there's some black magic and okay, we can do that as well. I'm not going to go into that discussion whether we should do, but okay, let's leave it as a third step. Let's identify, let's try to do what we can help, in the family, how we can make the child's life easier and understand his problems. Second is, let's go to a psychology, somebody who knows a psychiatrist or somebody, and then let's make it the third step. That's all I'm trying to say. Let's kind of leave it as a kind of later step, if this doesn't work. So I was saying that with psychology, with spiritual things, it's very misunderstood. I would classify myself as a religious person as well, and I would say that what we do is we kind of look at the surface. We give kind of surface information on the religion to our children, but we need to give deeper information. For example, we need to talk about the worldview. We need to talk about the philosophy of life. We need to talk about what do we understand from an Islamic perspective. What is life about? And life is a test. So if you'll start from life is a test, life is suffering, and then you should be grateful that you've got all body organs and all body parts. And that's what your expectation should be. And then if you have an adverse event in your life, then you can cope with it better. But if you're already okay, you should be the best, life should be perfect, no bad thing should happen, you can't deal with it. But this is also from the religion, what I just said. We all know that, but we kind of shelve it somewhere, and we don't keep it in our constant thinking that life is a test. Actually, it's meant we are meant to kind of face all sorts of tests and be strong. So what I would strongly emphasize is that parents talk about the religious understanding of the world and the philosophy of life with their children, because that equips them. They might think, they're too young for it, but no, they're not. And one of the things that's very important that they should talk about is how the world works. Who controls the world. A lot of psychological disorders are linked to because children don't understand who is in control. They feel that for example, the psychology of self-harm to some extent is where they blame themselves for doing something wrong. But they have to understand that the world, and for example, our belief is in the Quran, that not a leaf falls without the will of God. So if you understand not a leaf falls without the will of God, and everything is in His hands, then, in my hands, of course, I've got free will and I can do some things, but it's only very little that's in my hand. So if my uncle died, it was all part of God's plan. If I had an accident and I broke my leg, it was all part of God's plan. It wasn't something to do with me that I didn't walk the right way or something, So it is very helpful. And a lot of people will think, it's children are too young, but they're not. They have these questions and they need to be answered. And they might not ask that question. They will not ask that question, okay? And you have to answer that question without them asking it. So this is very, very important. This is what I would say is the spiritual treatment. And then the other spiritual treatment is, teaching about gratitude. This is a main theme of our religion: gratitude, patience. Okay, if they learn that, to be grateful in all situations, to be patient. This is going to turn their life around. They can always, whatever, there's an issue, and you can look at it in one way, and you can look at it and say the same thing in another way. You can totally reframe it. you can say, okay, this is a difficulty that I'm facing, but okay, I'll be patient and I'll get reward for it in the hereafter. I mean, this is not our understanding of this life is not. It's not just limited to this world. There's another world. I mean, that's the main part of the religious belief, that there's a hereafter. So even if you are facing just difficulties, but then this is not the end of it. It's good, because you will get all the reward for it in the next world. And children need to know that. They need to be reminded about it, rather than just kind of do superficial. Okay, read the Quran. Yeah, that's fine. You read the Quran as well, but how much will a child understand? You have to chew the teachings, and you have to break it down, and you have to explain to the child so that it will sink in, and he can develop that he can develop that understanding of what's happening in life. And this is all very relevant. This is what I would say the spiritual treatment.
Indeed. And Declan, you see people on a daily basis in terms of you come across people who have similar thing. You yourself have gone through a difficult phase in your life. So I just want to touch on a very quick basis. What do you reckon?
It's these are all difficult issues, no matter what community you come from. I go into schools. Recently, I went into a lovely big Stockwood Park Academy and did a talk with the Year 7, the whole Year 7, 240 kids, and to try and there is a complete cross section of the community, and I mean a complete cross section in that school in Farley Hill, and they were. I didn't know how they were going to take to me, and I didn't know how I was going to take to them, but they are the worst. That is the hardest group that you could ever go to address and speak to is school years, and when there's a whole of them. But once they got to listen about certain types of illness, because that's what it is. We can be ill in our bodies, but the invisible hidden one is the illness in the mind, and it's how it's dealt with and how you treat it. And most illnesses in the mind can be dealt with by starting off by talking about them. And most of them are anxiety and stress problems.
Indeed.
And seriously, and they can be, and I think no matter what community you come from, that is the same principle applies.
Absolutely. I mean, psychology is universal. It's it's the same psychology. You don't write different books or different psychology for different communities. It is universal. This is what I mean. It's also science. Please accept it.
we are all spiritual in our own way.
Yeah,
exactly.
We've all got emotions in our own way, and it's how we deal with them. And I think that the more we speak about them, I know we've had people call it the added bonus of having our royal family in this country who have suffered and have mental health issues, and openly talking about them in the mainstream media. That is a help along the way. It's not a cure, but it's a start, and it's about people talking. And most of these little small problems can be dealt with as simply as starting off by talking to each other, seeking the right type of help, and be signposted to the right person. That's the basics of it. And I think every child has that right, no matter what age.
Indeed. Now, wow, the time has almost coming to an end. Well, there's only 10 minutes to go before the end of the show. I do want to touch a basis of bullying and harassment, which we have heard in the first part of the show. So bullying and harassment is a very common factor to have emotional well-being issues. It is true. Now, let's start with you, Javeria. Is it true?
Bullying and harassment. Well, this is from someone who actually did suffer bullying when I was a young kid. The reason why I suffered bullying was because I was the only Asian, as it was, in an all-white school. This was years ago, where obviously issues of racism were prevalent, especially in Luton. I suffered bullying. I used to get picked on by kids. Never used to talk about it much, but obviously that made me become a stronger person, to make sure that I stand up for the rights of others, especially those who I feel were vulnerable. So, I mean, it has an impact. But however, having said that, again, it just goes back down to, young children, either in the home environment or they're actually at school. Well, obviously, bullying and getting harassed by peers is an issue. But unfortunately, it's just, again, we were discussing during the break, the doctor and also with Declan, is the fact that, teachers have enough on their plates. then being able to deal with all these other issues. But perhaps it could be the case that there are. So what used to happen, if I can just take back to when I was at college, for instance, I studied at Luton Sixth Form College. Luton Sixth Form College were quite brilliant. What they used to have is that they employed 2 community youth workers. Now, what these community youth workers were basically members of the community who were there as youth workers who young people could actually go and speak to about anything and everything. It may be the case that maybe things that you can't speak to your teacher. It could be the things that there are things you can't speak to actually to your parents, because you may think that they may think of you otherwise. You may feel uncomfortable, as it were. But, that's what these roles were of these community youth workers were. I mean, basically what they were doing, you were speaking to them. They were obviously, as well as that, they were organising events for you. They were trying to bring the youth together in terms of sports and arts and culture and so on. But they were there primarily for you to go and speak to, like a community counsellor type thing, who you can go and speak to. Those I find actually at Sixth Form College, that was a brilliant help. I think that's probably something that's lacking. A role model in the community, like a youth worker that you can actually go and speak to. And this obviously also goes to the fact and deals with the other issue of, again, like I said, coming back to the same point, it was about funding. We need funding for our youth services. Our youth services are starving. I mean, this is where our youth workers used to actually get paid from, but now obviously the ones that are still around, especially in Luton, are actually voluntary. And they do a fantastic job. I mean, one thing I'd like to say about Luton is that, Luton's third sector is absolutely brilliant when it comes to having all those extra charities, all those volunteers, from CHUMS to other organisations such as, I want to mention the Mind, BLMK, Stepping Stones, NOAA. They do fantastic work. I mean, our third sector is the backbone of Luton, and the amount of work and the amazing work that they actually do in terms of providing those essential services, which unfortunately we're not able to provide otherwise. Through that those volunteers, those committed times, that actually helps quite a lot, and especially with young people now. I mean, that's really very, very important.
Indeed. And I must say, yes, it is very, very important to highlight those as well. What is your clinical assessment? Have you seen any of the kids regarding bullying and harassment?
Of course, bullying. The child's world can be summed as the family and school. If he's at school and he's not homeschooled, so that's the child's entire world. And if he was in a friendship circle and suddenly he's not in that friendship circle, he fell out with them, that's the end of his world sometimes. Or especially we have to be careful about when the children transition from primary to secondary school, they're going to a big school, and that's a difficult time of life for a child. And there was that very unfortunate, very, very drastic, I mean, it was very sad case of that 11-year-old Asian boy hanging himself somewhere in the Midlands or somewhere, and it was this can happen, and it was all related to bullying. And nowadays, this is how bad it can be.
Nowadays, the
it's the mobile phones, exactly. And social media.
I would say if people can do it, they should ban their children from social media. For example, I've told my children you can have a social media after I'm dead, but not until that, because it is so detrimental. There's so many things, and we just don't have the time. I could kind of identify all the things, how they affect a child, and how they kind of affect everything in them, and how it can actually lead to disaster basically. But so social media, no social media. And the other thing is they, as I was saying, I'll again come back to that. Some people, it's much more common than we think, the neurodevelopmental disorders. And if your child is getting bullied, it might be because the other children, as I said, they're picking in him something that we are not even aware of, because they're kind of more or less all right, but we know there is something not right, and that might be the reason.
Exactly. Declan have some stats as well. Declan.
Well, there's huge stats on bullying, and it's about the young children. This is self-harm. I've got it on bullying, but just to go back to your bullying, there's 2 types of bullying. There's physical bullying from the big boy to the scared kid, and then there's emotional and bullying. And you'll probably find that some of the children that we've all been talking about this evening, they are the easy target of bullies in school, believe it or not. So the children who are suffering from emotional well-being issues already are the ones that suffer from bullying too, which is it's a double whammy on top of these poor children. But I know that schools are trying to are trying to work on this terrible scourge. But when you look at what the teachers, they're trying to put so much work onto teachers, but without all the work that they're doing already. They're now trying to introduce, I think the last throw of Theresa May's premiership is to tell the teachers they've now got to learn to become mental health therapists too. And then they have to watch out for bullying. I think we need separate therapists in school to look after this.
Exactly.
I don't think teachers
I agree
are
with
the
you on
ones.
that.
And then it's also about values. It's a lot about teaching your child the right values.
Yeah. I mean, one of the most important things I really want to touch upon, which I think is very important, is we need to talk about the mothers. In a family. Let's talk about the stigma in Asian families, for instance, around mental health, because mental health is a huge issue. I mean, it's a topic in itself, and mental health around adults, that's huge. That's something that needs to get addressed. It needs to be, spoken about. It needs to be addressed. There needs to be a proper conversation about this. But when it comes to mental health in Asian, in the Asian communities, that's something that needs to get addressed. That's something that needs to get spoken about. And one of the groups of people that we need to talk about are the mums. I mean, your dads are out there trying to, be the breadwinners. That's what they're trying to do. But then obviously it's the mothers that actually spend a lot of time with their children. Now, sometimes what usually happens is sometimes you have mums or newlyweds, especially women who come abroad from the Southeast Asian communities. They have a bit of when they come into the UK, they need to be provided with services, access to services, help, and so on. But it's the integration issue. I mean, who do they go to if they need to talk about X, Y, and Z? Who do they go to? How do they need to open up a bank account? How do they need to access services? How do they need to go and speak to Luton Council? That kind of stuff. It's about those integration issues, and obviously that can lead to mothers feeling under pressure. So, I mean, it's important that we need to talk about the mental health issues that those mums actually face, and it's really important that it's now is the time that obviously our community needs to address those and start talking about those.
Wow,
and how we can do that.
Definitely.
That's at a bigger level, but it also mothers' emotional health. Is so important for a child's well-being.
Indeed. Hopefully, inshallah, we will do all this. We will talk more about this subject. Unfortunately, the time for today is almost end. A very quick minute for quick messages from all of you before we end the show. So let's start with you, Declan.
Well, I just want to be able to put it out there that there is help and support for families out there, and CHUMS is one of them. Young Minds is another one. Childline is another one to give you great advice. There's many ways of seeking advice and getting the right signpost to the right people. But if anybody wants to contact CHUMS, they can do it. We have a great website which is fully kitted out for information, and they can contact us anytime, 24 hours a day.
Thank you. A quick 10-second message.
Mums need to kind of be more proactive about picking up the signs of poor mental health.
Thank you. Javeria?
My last message is basically we're going to be supporting our young children. We need to do more to support our young children, our adults, around mental health, and we need to raise more awareness. And there are information on the Luton Borough Council website on how to tackle and deal with these issues.
Perfect. Thank you so much all for coming in today and discussing about this topic, and we will definitely share this topic again in future times. Until next week, I'm your host Fahad Matin. Please remember us in your du'as. Assalamu alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.